Your health is the most important thing you can invest in. Good morning, everybody. This is Dr. Brenden Cochran from Interactive Health Clinic. Hope you're having a fantastic morning. Here to bring you some proactive tips to keep you going throughout this situation we are currently in. So today we're going to talk about what's going on with the death rates a little bit more. We're going to talk about proactive tips to using essential oils and how that can benefit you, or maybe that could harm you. What about the terrain is the last thing we're going to talk about. And I'm going to explain that a little bit more when we get to that section. So let's start off with tracking these deaths. Some sides are saying we're undercounting. Some sides are saying we're overcounting. Some are using improper test kits, which have false positives, and they're saying, oh, we got these cases and that don't have symptoms, and it's not a problem. And, bottom line, if we want to look at actual statistics, I'm going to actually show you below the graphs that look at what are the total death curves at this specific time of the year versus the general death curves. And I know this sounds really awful, guys, but I'm trying to paint this picture that this is a serious condition that we have on our hands. However, what we also have on our hands is things are being inappropriately managed, and some things are being pushed as magic bullet fixes, which doesn't happen. So I'm going to share with you in a document here, basically tracking against different countries, including even not a country, but a city, New York City, and where they stand compared to their normal ratio. And that would be a normal ratio with people who are succumbing to flu and other illnesses as well. So you can get an idea of this, and you can look at the global impact of this. So today's health topic we're going to talk about is immune modulation with essential oils. And specifically, one of them I want to talk about is eucalyptus oil. And there's some great research. I'm going to post one of them actually looking in 2010 at the immune modifying effects of using eucalyptus oil and using simple inhalation. So basically, we take the essential oil, we put it in some hot water, and then we breathe it in. We put a sheet overhead and we breathe that in. The other way we can do that is we rub a little essential oil below our nose and we simply breathe that in as well. I'm not a big proponent of taking essential oils orally. And the reason for that is, one, they're really concentrated, so you could, if you inappropriately dose, cause harm to yourself. Two is a lot of the essential oils out there are actually very poorly manufactured, and they have a lot of solvents and chemicals that are very, very toxic to you. So you really need to make sure you know which one you like to use. And I have a few favorites. If you want, just post the question. I'm happy to answer those questions, or send us a message at Interactive Health Clinic. I'm happy to tell you exact brands that we like. So really important, you get a good essential oil. You don't want one that's contaminated with all this junk, even if you're breathing in. The last thing you want to do is be breathing in acetone and other solvents in your system, thinking that you're doing a good thing, and you're actually causing more harm. But one of the things I liked about this study is it was looking specifically at things like staph, viruses, and fungi. So, and this was methicillin resistant. So this is MRSA, which is a really nasty one. It was looking at funguses and specific viruses in it as well. And it had some good results with people that were using it for things like bronchitis, asthma, COPD, or chronic obstructive pulmonary disease. So I'll let you take a look at that. I'm going to share that below. Another one I really liked was the protective of essential oils attenuates the influenza virus infection. Now, this was in vitro, so this was looking in a test tube situation. So that's the criticism of the study, because things in test tubes don't always extrapolate to humans or animals. However, they were looking specifically at using an essential oil blend to be treatment for the novel H1N1 influenza, which is another respiratory condition. So we have nothing that says specifically it treats COVID-19. However, again, anything in the respiratory category we should take and we should look at. Again, we don't want to be blinded and just looking for the magic bullet. We want to look at everything. So take a look at that study, but it really looks pretty good. It is, again, in vitro. So that means it is in a test tube. So it does have some questionable results there. The other one I really like is another one that came out in 2017, looked at antibacterial, antifungal, antiviral effects of an essential oil blend. Specifically, they were focusing on cinnamon and eucalyptus, and they were also looking at rosemary. And they were looking at bacteria, fungus again, and specifically viruses. This one came up. It was H1N1, the flu or your influenza, and HSV1, which is a herpes simplex that causes those little ugly breakouts that people get on their face. And they noticed that they were very, very helpful in combating those infections and those microorganisms. And this was not in vitro. So this was actually done in people. And I'll show you that study below too. And then finally, the one that fascinated me, and one thing we have to think about, this is actually in a Nurses Midwifery Journal, very interesting, 2016 that I pulled up. It looked at the effect of nebulizing. Now, nebulizing versus inhalation. Inhalation, you use hot water, put a towel over your head, breathe it in, or you use like a cold steam and you breathe it in, a cold mist. Nebulization, you actually have a nebulizer which vibrates this plate really rapidly and breaks the molecules really, really, really small, so then they can get all the way down into the very, very small pockets of your lungs, so it gets much farther down in the lungs. So nebulization always wins out on inhalation. However, if that's all you got is inhalation, use it. All right. Nebulizers are getting pretty cheap these days also to get a hold of as well. But they looked at the effect of nebulized eucalyptus oil, and specifically they were looking at the contamination of microbial plaque on an endotracheal tube used in ventilated patients. Hey, what's going on with our patients? They're being ventilated. We talked about in another video that ventilation may actually be causing harm because of the amount of oxygen that's going into a person because of the free radical damage that's going on. But what else could be going on? When we ventilate a patient, there's other microbes other than just this magical virus that's popping around. Fungus and bacteria, right? They all live together. And they can make things called biofilms, kind of like the stuff on your teeth that your dentist cleans up. It's called a biofilm. They say you better floss, otherwise you're going to have biofilm on there. That happens on these endotracheal tubes that are used in ventilated patients. Well, guess what? You have that going on. You have a patient that's ventilated for 24 days. Now you don't only have the virus, but you have these nasty biofilm microbes that are also growing on your ventilated tube in your patient. You think they're going to have a hard time? You think they're going to have cytokine storm? Absolutely they will. So this is something else we need to be thinking about, not just that we're oxygenating them, but maybe, just maybe, it's in there long enough that other microbes are colonizing the actual ventilator tube, forming biofilms, replicating, and causing more of a cytokine storm. So this is very interesting looking at this specific study, because they were actually, while people were ventilated and they were using this tube, it was also a randomized clinical trial in an intensive care unit. Wow, right? Now, the N was very small on this, so I have to say that was very small, but specifically they were looking at some bacteria in this that were causing biofilms. And what they would do is they would have people use 4 mils of 5% eucalyptus, so not very concentrated, right? 5% of eucalyptus oil in 6 mils of normal saline, and they would nebulize it in these patients every 8 hours. And they compared that to the placebo, and they got a statistically significant benefit of preventing those bacteria from colonizing and forming biofilms on the endotracheal tubes that were used in ventilated patients. Hey, maybe we should be looking at that. Maybe we should be thinking about that a little bit more in our patients as well. So that was a really cool find that I saw. And again, this was published in 2016. Why aren't we reading articles? It's important right now that we read articles and we all put our minds together, right? I think part of the reason why we're having these issues is, and I get it, sometimes in medicine we get stuck in a box and we just want to live in that one box and we only want to see things in a box. The problem is if we don't step outside that box and look at other factors that are going on, we often always lose. We never get people well. So this is another outside the box therapy we should think about, just like I talked about vitamin C, just like I talked about ozone, just like I talked about all my other natural agents. So this brings me to the terrain. Man, I wish people would actually get this through, because this is nothing new. You know, when we came up with the germ theory years and years and years ago, we had the scientists, Pasteur and crew, said that, hey, this germ will infect you and cause you harm. But the thing that there was another group that says, yeah, that's great. You got this germ that can cause you harm. But what we're seeing is not everybody's getting harmed by that same germ. So something else must be going on. And they kind of got in this battle. And what ended up winning was, well, the germ theory took off. So what do we do in medicine? We nuke everything. Oh, well, you got a bacteria. Let's take an antibiotic. Put it up your butt. Put it in your mouth. Put it anywhere you got it, right? Take an antibiotic. Oh, now you got a fungus. Holy cow, now we got to throw antifungals at you. Oh, we got a virus. Oh, let's kill the virus off. You see this? We're constantly trying to nuke the bug, but then the bug keeps coming back, or the bugs keep getting stronger and stronger and stronger. The only way you win is, guess what? You optimize the terrain. They had it right the whole time. And I would think in functional medicine, in natural medicine, in proactive medicine, we work on optimizing the terrain. So when something like this happens, it's not a complete disaster, right? So the optimization of your terrain has to be with everything I've been talking about, with the foods you're eating, with the stress levels you're having, with the sleep you're getting, with your hormones, with the contamination of environmental toxins. Bingo! Hey, I got another article I'm going to share with you. Basically said, hey, this virus can be detected on air pollution particles that may be carried over long distances. Now, does that mean they're actually alive by the time they land? I don't know. But it's very interesting that our pollution can carry this virus or these viral particles for long distances. Well, guess where the areas of large outbreaks are? Large city in Italy, New York City, large city in China, large cities, lots of pollution, right? So maybe it's being carried that way. But my thought is more likely is we're not looking at, again, the terrain. The pollution is causing the lungs to be more susceptible for the germs to enter. That's not that hard, right? It doesn't take a rocket scientist to figure that out. Well, maybe some, but we have some people that have some trouble figuring that out, or trouble even accepting that because they're stuck in the box. We got to break outside the box. So that's just one thing. We know pollution is a big issue, right? Air pollution, Roundup, acetone, perchlorates, that's basically jet fuel dumped. Your lungs don't like that. Your immune system doesn't like that. Your hormones don't like that. It screws up a lot of things if you keep doing that, right? It weakens your terrain, so then you can get infections easier. You're not as robust. Another thing we look at in terrain, this article, very, very cool. Basically, it said that the higher the sugar level was in the patient, the increased ability of those ACE2 receptors and the sugar found on the virus made that bond stronger. So a person that had a higher sugar level typically had a worsening outcome, or they had a stronger propensity for getting an infection, right? And these ACE2 are found all over the body: pancreas, blood vessels, lungs, kidneys, you name it, it's all over the place. And guess what? I'm going to read right from it right here. The degree and the control of the lung's immune response may also depend on how much sugar is attached to the virus spike protein, approximately 8 to 10 days after symptoms start, which may vary depending on your age and your sex. And then further, they went on to say, well, if you were diabetic, you were even worse. So those of you that are at home that are, not being productive, not optimizing your terrain, maybe cracking into that ice cream or those donuts or drinking extra beer or wine, you're just like asking for this to come in and wreck you, right? So you really need, it's not just I'm gaining weight, but it's like if you're a sugar binge person, you need to stop, 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 stop. And if you can't stop, you need to work with your doctor who knows how to help you get off those sugar binges. Because we know this puts you at risk. This jeopardizes your terrain. And everything we do in medicine, everything we look at, whether it be you have a bad joint, whether it be you're sick, when I approach a patient and people at our clinic and some of my colleagues approach a patient, we're looking at the terrain. We're looking at the bigger picture outside of the box. Again, if we get stuck in the box and we just focus on the germ theory about let's nuke this, let's vaccinate this, let's do that, we sometimes miss the other things. I'm not saying these are bad things. I'm just saying the other things are more important often that we address more than just the minute detail of killing the thing. So optimizing the terrain is critical. You see this in nature all the time, right? Your tree's not going to grow very well if it's got poor soil and it's not being watered, and it's more susceptible to likely getting a disease. And then once it gets the disease, guess what comes in next? Well, the insects come to eat your plants or eat your bugs. Well, the same thing happens in a body too. You don't optimize the terrain in the body, you're more likely to get ill faster and have more things happen to you. And unfortunately, people usually come into us after their terrain's been totally wrecked. Why? Because they've been thrown drugs, looking for a magic cure. They've been nuked with things, not getting the answers. When we could have started with the terrain, build the foundation, build the terrain, and build that house that will stand 1,000 years. So right now, proactive health is the most important thing you can do right now to protect yourself. All right, guys. Hope you had a great one. We'll see you Friday. We're going to bring you some more updates.